Assalamu alaikum wa rahmatullahi wa barakatuh. Inshallah, we are going to start our class with respiratory system terminologies in our beautiful course, medical terminology. So before we continue, I will call on you people to please stay at home. Stay safe, stay at home. If you stay at home, you will not be infected and you will not infect others. And please, if you experience any sign of this deadly COVID-19, please call the NCDC to take care of you. Or if you suspect someone with one of the signs of COVID-19, advise him or her to call NCDC. You people are aware of the signs of this deadly disease. There is number 1, high fever. Number 2, coughing and sneezing. And number 3, cessation of breathing. So please, when you notice someone with this, and maybe you knew that he or she traveled and came back from abroad, or Abuja, Lagos, or here in Kaduna, please advise him to isolate himself or herself. Then call NCDC. May Allah protect us all. Ameen Ya Rabbah. Before the end of this class, inshallah, we will know some of the general respiratory system terminology. Some, I said some. Number 2, some of the respiratory system diseases. And lastly, number 3, some of the system specialists and procedures. Number 1, the respiratory system general terms. We have number 1, rhino, that is nose or rhino. Example, rhinitis, inflammation of the nose, or rhinitis. Then we have rhinorrhea or rhinorrhea, watery nose, watery mucus coming out of one's nose. You call it rhinorrhea. Number 2, laryngo, that is larynx. In a layman's English, voice box, larynx. Example, laryngotomy, the temporary mouth, that is to cut into the larynx temporarily. To cut into the larynx temporarily, we call it laryngotomy. And we have laryngectomy. We have laryngectomy, that is surgical removal of the larynx. Number 3, trachea, that is trachea. In a layman's English, windpipe. Turanci 'yan kasuwa, windpipe. Example, tracheotomy, to cut into the trachea temporarily. Number 2, tracheostomy, to make a permanent mount into the trachea. Number 4, broncho, lung or air passageways, lung air passageways. Example, bronchoscopy, to look into the bronchi. bronchitis, inflammation of the bronchi. Number 5, near. We all know in medical terminologies we have 3 fundamentals: word root, number 1, number 2, prefix, and number 3, suffix. So we have near is one of the fundamentals. The near fall in one of the fundamentals, that is the suffix. Near means related to breath or related to ear. Example, keep near. All of you know what taki means. That is fast, near breathing. Keep near, fast breathing or accelerated breathing. Dyspnea, difficult or painful breathing. And we have apnea, cessation of breathing. Apnea, cessation of breathing, as in coronavirus, as in coronavirus. Number 6, pulmo, lung. Example, we have pulmonary artery. That is relating. Example, we have pulmonary artery, the blood vessels that carries deoxygenated blood, venous blood from the heart to the lungs. And we have pulmonary vein. Blood vessels that brings in oxygenated blood to the heart from the lungs. And we have pulmonic valve. A sphincter, a valve that a sphincter or a valve that is in the first portion of the pulmonary trunk in the heart. ina kallo ne fa, ina kallon film. Number 7, pneumo, relating to the lung or relating to the presence of air. Example, we have pneumogastric nerve, a pneumogastric nerve. And we have pneumothorax. Pneumothorax means leakage of air from the lungs to the chest wall. Pneumothorax. Phthisis. Can you see it? Number 8, phthisis. Another suffix, phthisis. Spitting or coughing. Example, hemoptysis, coughing up blood from lungs. Hemoptysis. Hemo means blood, tysis means cough. So coughing up blood from lungs means hemoptysis. Ina fata ana fahimta na, that is tari da jini, hemoptysis. Number 9, another suffix, plasty, meaning reconstruction. Example, rhinoplasty, reconstruction of nose. Rhinoplasty or rhinoplasty, reconstruction of nose. But plasty ba ana yin shi kawai respiratory system terminologies kawai ba. For instance, plasty, it is done also in reproductive system terminologies, as in mammoplasty. Mata 'yan gayu waɗanda nonuwan suka zube, they perform mammoplasty su gyara, like yayi. That is the end of the general respiratory system terminologies. And now we are to continue with respiratory system diseases. Number 1, we have pneumoconiosis. Ina fata dai ba tambaya. Pneumoconiosis means abnormal condition of dust in the lungs. It is the generic name for condition where toxic particles become trapped in the lungs and cause symptoms like black lungs. Ma'aikatan da suke aiki waje mai kura ko wanda wani waje abu ke tashi, misali asbestosis, in ana aiki a wajen da ake yin asbestos, so kuran in aka ganshi a lungs shine mene abnormal condition, that is of the presence of asbestos in the lungs, and it also causes the complication of asbestosis is called it causes cancer of the lungs and cancer of the pleura. Number 2, epistaxis. Haɓo, nosebleed, an san wannan epistaxis. Epistaxis, nosebleed, epistaxis, nosebleed. Epistaxis, nosebleed. Akwai emphysema, is one of the COPD, that is chronic obstructive pulmonary disease. Abin da ke tushe numfashi a kasa numfashi. Obstruction, obstructive pulmonary disease, which result in progressive destruction of air sacs. An san air sacs ko? Akwai daga bronchi, in aka shiga ciki can akwai bronchioles, daga bronchioles akwai alveoli, su ne ake kira air sacs. So anan ne ake samun exchange of gas between the alveoli and the blood capillaries. So an suka samu destruction, babu su, kun ga dole a samu obstruction na iska, so shine ake kiran wannan ciwo emphysema. Emphysema. Akwai number 4, atelectasis, collapse of a part or whole lungs caused by the inner factors. Collapse of one bangare ko kuma duka lungs din caused by the inner factors. Misali pneumothorax, that is leakage of air, yana sa ana samun atelectasis. Kun ga pneumothorax yana faruwa ne a ciki, so mashaya sigari su suke iya samun ciwon daurori. Mashaya a daina, in kina sha kana sha wallahi a bari. So respiratory system specialist and procedures. Muna da respiratory therapist is a specially trained health personnel examine patients with breathing or cardiopulmonary disorders. Shi yana examining patients with breathing or cardiopulmonary disorder. Shi wannan, their patients are range from infants wa'inda suke da undeveloped lungs, sannan kuma and elderly who have lung diseases. Sannan they also provide emergency care to patients with heart attack, drowning or shock. Drowning a nutse a cikin ruwa, to respiratory therapist na taimakawa ko a samu shock, an san shock, kuna yin first aid yawa, ko kuma heart attack, Allah ta'ala ya kiyaye. Number 2, pulmonologist, a physician specializing in the disease of the lungs. A physician wanda ya san ciwukan da suke damun lungs, jakar numfashi, so muna kiran shi pulmonologist. But patient needing surgery, that is respiratory surgery, are referred to a general surgeon. Amma an aiki za a yi ba shi zai ba, general surgeon ne zai aiki. Amma in ciwo ne, duk wani ciwo na numfashi ana referring ɗinka ne to pulmonologist. Ana fata an gane ne. Number 3, akwai pulmonary angiography, is the special x-ray of the vessels of the lungs. Pulmonary angiography, an ce angiography, x-rays of the blood vessels, shi ake kira angiography. Pulmonary angiography kuma x-rays of the blood vessels of the lungs. Misali x-rays of the pulmonary arteries, x-rays of the pulmonary veins. Yawa. Akwai number 4, laryngoscopy, visual examination of the larynx with laryngoscope. An ana so a duba voice box din mutane, a kalli hoton shi, ana yin laryngoscopy. So sunan abun da ake amfani da shi During the laryngoscopy, we call it laryngoscope. Number 5 and the last of our class today is endotracheal intubation. Endotracheal intubation. Endotracheal intubation, that is meaning passing a special tube into the trachea so oxygen can be reliably supplied into the lungs without risk of inhaling or vomit into the stomach. Misali ana sa wani pipe ne a shigar da shi. Endo means inner, ko trachea. Intubation to insert tube means intubation, to insert tube insertion. So endotracheal intubation meaning what? Inserting of tube into the trachea to allow supply of oxygen. Yawa, saboda yawanci ana yi ma mutane that are what? Unconscious. Endotracheal intubation is typically done for surgery or what? Whenever general anesthesia is administered, where the patient's airways must be secured. So kaga zai iya hana amai ko wani abu karkare zo mutum wajen numfashi, in an bashi na numfashi ya zama ya shaƙe, an samu damuwa. So amma in akwai endotracheal intubation sai iska ya ringa shiga direct into his or her lungs. So anan muka kawo ƙarshen lectures ɗinmu respiratory system terminologies. Inshallah, if there is question you can DM me, you can direct message me, saboda in ka ce za ka yi a group ba kullum a yi haƙuri nake shiga group ɗin ba. Yawa, ko kuma in an lura lokacin ina online za a yi a group ɗin. Yawa, ina shiga sai in duba. Sannan kuma ina roƙo you people will remind me da wayansu systems ne ba mu yi ba, so that sai mu ci gaba inshallahu a next class. Stay home, stay safe. Coronavirus is real. COVID-19 is killing. Wassalamu alaikum wa rahmatullahi wa barakatuh.